The Synocta cemented abutments for cement-retained crowns and bridges adds to the range of indications for the Synocta prosthetic system. The determining advantage is that the abutment can be shortened on the model by the dental technician instead of in the mouth by the doctor. This allows the superstructure to be optimized for the clinical situation. Osseointegration of the 3 Straumann implants in this 32-year-old patient was uncomplicated. This is demonstrated by auscultation and by the soft tissues which are free of irritation. The Straumann implant wide neck at tooth 4-5 and the 2 Straumann standard implants regular neck for the congenitally absent 1-5 and 2-5 had been inserted 8 weeks previously. For impression taking, the SCS healing caps are removed and the internal threadings of the implants are thoroughly cleaned and dried. Then the impression caps are placed on the respective implant shoulders and snapped firmly into place. The rotation test shows that the impression caps are securely positioned. Next, the positioning cylinder is aligned inside the impression coping and inserted as far as it will go. There should be no gaps between the impression coping and the positioning cylinder. The same procedure is used for the wide neck implant. The impression is taken using a custom impression tray and an elastomeric impression material. This is the finished impression of the upper and lower jaws. The implants are now once again closed using the SCS healing caps. The corresponding analogues are selected in the dental laboratory. When repositioning the analogues, care must be taken to ensure that their shoulders snap firmly into place. A gingival mask should always be used to achieve an optimal cervical crown contour. The working model is created, as usual, using dental stone. These are the completed working models with the 3 implant analogues and the gingival mask. After checking the clinical situation on an articulator, abutments can now be selected. For this purpose, a special prosthetic planning kit is available to dental technicians to facilitate the choice of the correct components and to keep inventory levels at a minimum. This planning kit includes plastic try-in abutments for crowns and bridges that can be placed on the implant analogues to verify their heights and axial inclinations. First, the dental technician hand tightens the Synocta cemented abutments in place on the analogues using the SCS screwdriver. Care must be taken to ensure that the abutment is placed within the octagon of the analogue. Now the clinical situation is reviewed on the articulator and, if necessary, as in this case, the occlusal distance is corrected by reducing the length of the abutments. The dental technician can subsequently use prefabricated parts for creating the superstructure. In this case, Castable Synocta burnout plastic copings for crowns were placed on the shortened abutments by pressing until the caps clicked into place. These caps are cut in height as required. Once this is done, the crown framework is waxed up as usual according to standard veneering techniques. Once completed, the superstructure model is invested. After the initial casting, the snap-on mechanism must be removed with the reamer before placing the casting on the analogues. After core firing, the casting is veneered following anatomical guidelines. This is followed by main firing, correction firing, and glaze firing. These are the finished porcelain fused to metal crowns. They can be seated on the analogues without the slightest tension. To ensure correct transfer of the positions of the Synocta cemented abutment from the working cast to the patient in the dental office, a transfer aid can be used. It's made of plastic, can be attached by polymerization, and can be slid onto the Synocta cemented abutment. A resin index is created on the working cast in order to transfer the abutments to the patient. The structure is handed over to the dentist with the custom-reduced Synocta cemented abutments on the working model. In the dental office, the healing caps are removed, and the interiors of the implants are thoroughly cleaned and dried. Then the Synocta cemented abutments are placed inside the internal octagons of the implants using the transfer index that was created. Using the SCS screwdriver and the ratchet with torque control device, the base screws are tightened in the abutments. The torque should be 35 Newton-centimeters. Now the restoration is ready for trial insertion in order to check for proper occlusion and articulation. If necessary, any occlusal corrections are made, followed by final polishing. A glass ionomer cement or zinc phosphate cement is used for final cementing. The Synocta cemented abutment for cement-retained restorations allows custom shortening by approximately 1 to a maximum of 2 millimeters, which can be done directly on the model, and the safe transfer of the abutment from the model to the implant.
Ganz, ganz toll, ja. Umwerfend.